Hello, my name is Sheila Hardesty, and I have prepared a research proposal presentation for my evidence-based nursing practice class through Davis and Elkins College, and I would like to share it with you today. I have an audience here with me, my son Adam, my granddaughter Layla, the angel, and my daughter Rachel. The title of my proposal is Will Identifying and Reducing Common Barriers to Required Accurate Nursing Documentation Improve the Quality of Patient Care? Nursing documentation is to be clear, concise, and accurate, with no omissions of pertinent information. Communication through documentation should quickly alert others providing care to changes in a patient's condition. Communication through documentation broadens the understanding of human experiences and responses to illness, rehabilitation, disease, and death. Through clear, concise documentation, nurses make decisions about their patients' care needs, track changes in their patient's acuity level, and safeguard their patient's continuity of care. As professional nurses, inaccurate charting or omission of necessary details from our documentation can have negative effects on the delivery of quality care. Nurse managers are always on a quest to improve nursing documentation, thus ensuring quality of care and adequate reimbursement while meeting legal requirements. Will identifying and reducing common barriers to required accurate nursing documentation improve the quality of patient care? I reviewed some literature from different facilities and organizations where they had found some gaps or errors in their documentation processes. I would like to share them with you. It is important for nurses to record information so that their documentation has meaning and communicates assessments, observations, and any change in the patient's condition. It is necessary to document positive and negative findings, communicating clear facts to all healthcare professionals involved in the patient's plan of care. Communication through documentation will quickly alert others providing care to changes in condition. Nursing Journal emphasizes the use of correct grammar, spelling, terminology, abbreviations, and measurable terms to avoid misinterpretations in our documentation. An improved nursing documentation system was needed at Riverview Medical Center. A system was developed to save the nurses time through introducing the possibility of flawless documentation with voice-activated software programs. Joanne Trofino noted in Nursing Management the fact that regulatory agencies visit healthcare organizations to conduct chart reviews and draw conclusions about the quality of patient care and the responsiveness of the healthcare providers to establish standards from the documentation recorded by doctors and nurses. In years past, nurses charted brief notes modeled to a generalized plan of care documenting their patients' responses to illness, disease, treatment, and their environment. The advancement of technology in healthcare today requires nurses to chart ongoing data, collecting and sorting what is pertinent and measurable for clear, concise documentation. Trofino also notes a medical record containing errors and omissions in documentation jeopardizes adequate reimbursement, clear communication between healthcare providers, and continuities of care, as well as legal requirements. Standard treatment protocols are used by many facilities and organizations. Are standard protocols followed with accurate documentation to prove the care was given? According to pre-hospital emergency care, there are errors of omission in the treatment of pre-hospital chest pain patients, documented or not documented by paramedics without protocol adherence. Pre-hospital emergency care reported a sample of emergency medical service records were obtained from 4 ambulance companies with written documentation revealed a significant number of patients did not receive care or it was not documented. that they did receive care recommended by protocols. Maybe the recommended intervention was to give an aspirin, and it was not documented that the aspirin was given. Therefore, when EMS arrived at the hospital, maybe the required amount of aspirin was administered twice, or it had been documented that an aspirin was given in prevention, and the healthcare provider had not actually given it, the EMS staff, so when they got to the hospital, they did not get the aspirin they needed. Therefore, a performance plan must be put in place to improve adherence to protocol and documentation of the delivery of care, as well as increase lives saved in life-threatening situations. Another source of literature, Infection Control and Hospital Epidemiology, notes that accurate documentation of vascular access in the electronic medical record is standard nursing practice. The National Healthcare Safety Network, or NHSN, completed a study to validate a process to measure central venous catheter days from nursing documentation. According to Infection Control and Hospital Epidemiology, error rates were measured using both manual and automated validation methods. These measurements allowed determination of error rates consistent with the NHSN methodology, a method in which errors of omission or commission could negate each other. An automated tracking tool to calculate the documentation error rate was used. Infection Control and Epidemiology also notes the electronic medical record provides a sustainable source of central venous catheter days data without increasing the data collection burden. Feedback from the study was used to develop tools and implement interventions to eliminate errors of documentation of central venous catheter days, which could lead to inaccurate central venous catheter day counts. The journal emphasizes that central venous catheter day counts need to be trusted for accuracy throughout the organization. The implementation of process improvement interventions decreased errors in documentation to a minimal level. It's important to maintain infection control, that we as healthcare providers abide the protocols and policies that are set out for us. For instance, a peripheral IV is to be changed every 3 days. The tubing is to be changed every 3 days or 72 hours. And any maintenance fluids hanging should always be changed every 24 hours. If these protocols are not followed, we are not maintaining infection control, and people can end up with bacteria in their bloodstream and other serious complications. Excuse me. Evolving technology has increased the availability and accessibility of software with documentation tools developed for the improvement of nursing documentation. These tools are available for trauma care, med-surg, ICU, and many other fields in nursing and in the healthcare industry. According to the Journal of Trauma Nursing, the Emergency Nurse Documentation Improvement Tool, or ENDIT, system was implemented as a performance improvement model, utilizing existing computer software in a Level 1 trauma center. The journal also notes that the system provides the professional nurse with quick, computerized feedback when the documentation of a trauma case needs further attention. The journal also reports that feedback is provided in written form and uses peer mentoring to improve accountability and documentation, thus decreasing documentation, omissions, and mistakes by 21%. So that performance plan is very successful to decrease by 21%, and if they run another root cause analysis cycle, they may decrease it another 21% or even more. The study I have planned will identify the most common causes of barriers to accurate nursing documentation. Errors of documentation often result in harm to our patients, thus making it necessary for the healthcare industry to explore why these mistakes occur through ongoing root cause analysis. According to our textbook, qualitative research can be descriptive or interpretive. Descriptive research establishes basic knowledge of human responses to health and illness, whereas interpretive research is a form of analysis that involves extracting meaning from data, which requires thought or study on the part of the researcher. As far as my methods, my research design is a qualitative descriptive study. Sample size and characteristics of the sample participants is a convenience sample of 50 nurses on the Med-Surg unit at the hospital where I work. Data collection will be completed with the nurses receiving a descriptive narrative questionnaire online through an email that they will complete and resubmit to our unit nurse manager. Data analysis would be the descriptive questionnaire results will be analyzed in an interpretive way, grouped into categories, and displayed with a bar graph, emailed to the participants, and presented at shift meeting for brainstorming and root cause analysis. Ethical consideration and consent. As far as that goes, the Med-Surg nurses will participate voluntarily with hopes of a 100% response rate related to the expected outcome of the study, which is reduction of common documentation barriers on our Med-Surg unit, which will improve professionalism, job performance, charting, and quality of patient care. My data collection instrument will be a narrative questionnaire completed by the nurses on the Med-Surg unit. The questionnaire will consist of open-ended questions to promote validity. Open-ended questions generate meaningful data while giving the participants a chance to respond to each question in detail. The questionnaire will have a signature section stating that the nurses are participating in a voluntary study. The signatures will be removed from the data before analysis to maintain the autonomy of the participants. All Med-Surg nurses will be encouraged to participate. Collecting the data in a systematic way will provide feedback to nursing management as well as the Med-Surg nursing staff. All Med-Surg nursing staff will send their completed questionnaire to our unit nurse manager in a return email via the internet, as I mentioned previously. The narrative questionnaire for the Med-Surg nurses will have questions. I'll give you a few examples of what questions may be on this questionnaire or will be on this questionnaire. Do you chart everything or just what is required in order to leave work on time at the end of your shift because of pressure about overtime, or maybe you have responsibilities that have to be maintained after work? Is the amount of required documentation too much? Yes. What distractions interfere with your documentation time? Does the acuity level of your patients interfere with your charting? Does the lack of communication between healthcare members cause needed clarification to enable accurate documentation and delivery of care? Does job performance from your CNA or other healthcare team members affect your documentation? Please describe any barriers you encounter other than those mentioned above while attempting to chart in a professional manner. Now, if I actually proceeded with this study and conducted it, some of the results I would expect to come back from the questionnaire would be lack of knowledge or education and training, lack of communication between members of the healthcare team, job performance of your nursing assistant or other members of the healthcare team. One person cannot carry other people's load when acuity levels are high and facilities are busy. Everyone needs to carry their own load in order to ensure quality care, delivery of care. Lack of access to MD and pharmacy staff for clarifications to ensure accurate documentation or delivery of care. Staffing shortages, which affect the nurse-patient ratio. Exhaustion related to long shifts or mandated shifts, may be related to call-offs. Acuity level, call bells, bedside patient care, assisting MDs with procedures, treatments, dressing changes. Amount of required documentation or double documentation. As far as data analysis, the results from the questionnaire will be grouped together by categories. Results will be emailed to the participants and presented at shift meeting. Root cause analysis cycles will be run for the development and implementation of tools and concepts to reduce barriers to documentation. As far as the data presentation, you can see my PowerPoint here. I'll submit it with my presentation, but I have a bar graph with some categories such as acuity and staffing, job performance of peers, documentation and transcription, environmental and time management. Some barriers will fit into more than one category and maybe into 2 or 3. In conclusion, clear, concise documentation enables communication of changes in the patient's condition to implement necessary changes in their plan of care, thus protecting continuity of care. Identifying and reducing barriers to required accurate nursing documentation will improve quality of care on our med-surg unit. Applying qualitative descriptive research or credible data enables our practice to be evidence-based. Please take a moment and review my references that I used for the literature review for this presentation. Does anyone have any questions?
No.
No questions at all?
No.
Okay. All right, so from my presentation, I'm sure that you all see how important it is for nurses to document accurately, make sure the right medications are given, the right amount of medications, that they're not given, that they're not given twice, the right treatments are carried out, the right transcription of doctor's orders is followed so that the documentation is accurate when the orders are noted off. And this is the reason for the significant importance of my study to prevent errors in documentation in healthcare and ensure our patients' quality of safety. Thank you.